Good morning, everyone, and welcome to the Ajax Public Library's Overview of Dementia program presented by the Alzheimer Society of Durham Region. I'm Julia Campbell, and I'm the Adult Services Librarian at the Ajax Public Library. Thank you so much for joining us this morning. I just wanted to start with a couple of housekeeping items. This morning's presentation is being recorded, so I would ask that you please keep yourself muted so that you are not heard in the recording and to minimize any distractions. We do have quite a large group joining us today. And as always, the chat button is along the bottom if you have any questions or comments you would like to share. Please feel free to put any questions throughout the presentation in the chat, and our presenter Ashley will get to them during our Q&A at the end of the presentation. And just to get the chat going, if you would like to share where you're logging on from today in the chat, we would love to see where everyone is tuning in from for today's program. And we do have closed captioning of our program today, so if you would like to turn on the captions, you can do so by clicking live transcript at the bottom of the Zoom screen and then show subtitles. And if you do experience any technical difficulties, I recommend that you exit the Zoom and re-enter. And if you continue to have difficulties, please place a comment in the chat, and either myself or one of the other library staff members will do our best to assist you. So now it is my pleasure to introduce our presenter, Ashley Ferraccioli, a Community Engagement Coordinator with the Alzheimer Society of Durham Region. She recently started this position after working in long-term care for 13 years. She's a graduate from York University with a Bachelor of Arts honors degree in sociology, and has also completed a post-grad program at Georgian College for recreation and gerontology, and then most recently began her master's in counseling psychology. She has a passion for working with people and helping people live their best lives. When not working or studying, she enjoys spending time with her 2 daughters, husband, and their golden retriever. We are very lucky to have her with us today, so without further ado, I will turn it over to Ashley to begin her presentation. Welcome, Ashley.
Thank you so much, Julia, and thank you everybody for joining me today. Julia, I'm just not able to share my screen though.
I'll just make you a co-host.
Perfect, thank you.
There we go.
Perfect. So today we're going to learn about dementia, some of the different causes, some of the different types. And as Julia mentioned, if you have any questions, please feel free to put them in the chat. We will save some time at the end to answer any questions that you do have. So first, let's start by looking at the numbers. So in Canada, currently there's estimated to be over 500,000 people currently living with dementia, and that number is expected to grow. There are about 76,000 people who are diagnosed each year in Canada, and it's estimated that by 2030, there'll be about 912,000 people in Canada living with dementia. So quite an exponential growth in 8 years. And 1 in 5 of us will experience being a care partner for a person living with dementia. So that is a neighbor, a spouse, a family member, a friend, someone in our lives that will be diagnosed with dementia, and we will continue to support them. It's also estimated that in Durham Region alone, there is 11,843 people currently living with dementia. So in our community, we can see that the numbers are definitely high and unfortunately will continue to grow. So it's important that we build that awareness and understanding of what dementia is, some things that we can do to prevent it, and also some warning signs and things to look out for. So what is dementia? Well, dementia is an umbrella term that's used for any disease that causes changes in the brain that will get worse over time. So it is progressive. And changes can include things like memory loss, problems with language, trouble with familiar tasks like getting dressed or tying your shoes, making a meal. And dementia is diagnosed when these changes start to affect a person's everyday life. There is no single diagnostic test to diagnose dementia, but instead a doctor will rule out some other conditions that we will talk about shortly. So changes experienced by the person depend on where the damage is occurring in the brain. And so people will experience dementia differently. We often say at the Alzheimer Society that if you've met one person with dementia, you've met one person with dementia. And that's because it is so unique. So no 2 people will experience it the same. Their symptoms will look different. Their progression will be different. There is no clear path or roadmap for someone's diagnosis. And there is actually estimated to be over 90 different types of dementia. However, today we're just going to go over the 4 most common types. So our first one is Alzheimer's disease, which many of you have probably heard about. It is our most common, and it does account for about 60 to 80% of all diagnosis. And the damage from Alzheimer's disease starts in the hippocampus of the brain, which that's where we make our memories. And this is why a short-term memory loss is usually an early symptom. It will slowly progress to other regions of the brain throughout the disease process. Our next type is vascular dementia, and it accounts for about 20% of all dementia diagnosis. And typically this occurs with strokes or mini strokes when there is a lack of oxygen that's getting to the brain. So depending where the stroke occurs in the brain or which area of the brain is deprived of oxygen, that will determine which cognitive losses somebody experiences. Lewy body dementia is our next most common, and it accounts for about 5 to 15% of all cases. And in Lewy body dementia, you may not see memory loss as an early symptom, but areas in the brain that are involved in movement and thinking are often most affected. So a person may experience symptoms that are similar to Parkinson's disease, such as rigidity or stiffness of their muscles, tremors or shaking. They may have stooped posture or slow shuffling movements when they walk. They may also experience marked fluctuations in alertness. They may suffer from visual hallucinations, so seeing things that aren't real, like bugs on the ceiling or children outside playing. And these can be common or worse during times of increased confusion. And our last most common type is frontotemporal dementia, and it accounts for about 2 to 5% of all cases. And frontotemporal dementia is another umbrella term for a group of rare disorders that primarily affect the frontal and the temporal regions of the brain. And these areas are generally associated with personality, behavior, emotions, language, speech, abstract thinking, and movement. So changes in the brain often lead to changes in behavior, and problems with speech are generally an early sign. It's also important to note that dementia doesn't affect just older people. That's often a misconception. There are actually a number of people in their 30s, 40s, 50s, and even 60s who are living with dementia. And if a person is diagnosed before the age of 65, it's known as early onset dementia. So what's most common amongst these forms of dementia is that there is no cure and that they are all progressive. So they will get worse over time. So like I mentioned, before someone typically gets a diagnosis, the doctor will look to rule out some other treatable conditions that may cause things that we refer to as a temporary dementia or a reversible dementia, just meaning that they cause similar symptoms to, but the doctor likes to rule these out just to make sure that there's nothing else happening. So these include things like depression. So depression can mimic dementia with symptoms such as mood changes, personality changes, apathy, loss of ambition, or social isolation. Infection and delirium can also cause severe dementia symptoms in a very short period of time. Sometimes it's in a matter of hours. So between breakfast and lunch, we notice that somebody's behavior has really, really changed. That can be an infection or a delirium. Medication side effects is another one. So side effects of some medications or not taking them properly, not taking them on time, can cause a temporary dementia. Metabolic disorders, things like liver disease, diabetes, dehydration. Vision or hearing impairment. So left untreated can cause confusion or disorientation. If you imagine being hearing impaired and you can't hear what's going on around you and someone's giving you directions, it can lead to some disorientation or confusion because you're not understanding what's being said. Sleep disorders. Sleep is imperative to our physical and mental well-being. Things like sleep deprivation, insomnia, sleep apnea, they can resemble signs of dementia at times. And the last one is nutritional deficiencies. such as dietary or vitamin deficiencies. They can also cause dementia symptoms. Then there's other things like head trauma, maybe due to falls or concussions, tumors, or thyroid problems as well. So typically there are 10 warning signs that we look for when it comes to Alzheimer's disease. So I apologize if the pictograph there is a little small, but I will go through them. So the first one is memory loss that affects day-to-day ability. So that's forgetting things or struggling to retain new information. Maybe they're asking the same question multiple times, and that's because their brain can no longer hold on to those recent memories or that information that you just gave them. The next one there is difficulty performing familiar tasks. So that's forgetting how to do something you've always done your whole life. So you'll see in the picture there, somebody's trying to cook. They may not be able to do that, but they've done it their whole life, or they may have trouble getting dressed. They don't know in what steps or how to button their shirt, tie their shoes, things like that. Our next one is problems with language. So that's forgetting simple words or substituting words that don't fit in the context. So the person may say, "Where's my cold?" But what they're trying to tell you is that they're cold and they're looking for their sweater. So sometimes we have to investigate a little bit what the person is trying to tell us. Our next one here is disorientation in time and space. So that may be not knowing what day of the week it is or getting lost in a familiar place. So maybe the person has walked around their neighborhood in the exact same route every day for 20 years, and now they're starting to get lost and they can't find their way home. That would be a warning sign. Impaired judgment is the last one on our top row here. And that's not recognizing that a medical problem needs attention, or maybe they're wearing light clothing on a cold day, or they've put on their winter jacket and they're headed outside today when it's about to reach 40 degrees. Problems with abstract thinking is also another warning sign. So the person may have difficulty balancing their checkbook. They may not understand what numbers are or how they're used anymore. Number 7 there is misplacing things in unusual places. So we can see here the lady in the diagram has put her dress in the fridge. Or we hear examples of people putting their wristwatch in the sugar bowl because it looks like a jewelry box. Changes in mood and behavior is also a warning sign. So someone may exhibit severe mood swings from being easygoing 1 minute to quick-tempered the next. 1 minute they're laughing, the next minute they're crying or they're angry, and there's no apparent reason for this change. Our second last one here is changes in personality. And that's acting out of character for a person. Maybe they're more confused, they're suspicious, they're or fearful even. And our last one is loss of initiative. So this may be losing interest in friends or family or their favorite activities. Maybe someone has always gone to church every Sunday and now they no longer have any interest in that. Those can all be some of our major warning signs that we want to look out for. So if you or someone you know have any of these warning signs, it's important to get medical attention so that those treatable conditions that we talked about a few minutes ago can be ruled out and you can get the right supports in place. And as I mentioned, there is no single diagnostic test to tell if a person has dementia. So the diagnosis is made by eliminating those other causes. Early diagnosis and treatment has some very promising results, though, which is very optimistic and good to hear. And that can help the person living with dementia to continue to engage in those activities that they enjoy. And it may also slow down the progression. So there are some medications that help to reduce the symptoms of dementia, but there is no cure. But the focus here is more about making sure that the person has the best quality of life for as long as possible. So when we look at the progression of cognitive decline, slight cognitive changes are a normal part of aging. However, when the problem becomes significant or affects a person's day-to-day life, that's generally when we need to seek attention. So typically a person will notice changes long before there's actually a diagnosis. We often hear spouses or family members say, I noticed the sign for years before dad or mom or whoever got the diagnosis. So in this graph, we can see how that happens. So sometimes people start out in a silent phase, which is where changes in the brain happen without any measurable symptoms. So someone may notice those changes in themselves, but the doctor isn't really going to be able to pick it up on any mental examinations or mental tests that they perform. And then as things decline a little bit more, we get to the MCI, which is mild cognitive impairment. And this is where those cognitive changes are of concern to the person and their family. And one or more cognitive domains may be impaired significantly, but their ability to engage in activities of daily life is still intact. And then we can see another decline as the symptoms worsen. That's typically where we get that diagnosis of dementia. And that's where cognitive impairment is severe enough to interfere with their everyday abilities. So typically there are 4 stages of dementia. And it's important to recognize that dementia is progressive and that symptoms will change and develop with time. And I did mention at the beginning, there is no set path for how someone will experience dementia, and that includes how long someone will be in each stage. It is very unique to each person. Some people decline more rapidly, some people it's slow and steady. The average prognosis is about 8 to 12 years. And it's known that the capacity will decline with the progression of the disease and activities will need to be adjusted. So in the later stages, if someone can't get dressed anymore, there's probably still pieces of that task they can do. Maybe they could still put their arms in a shirt, but they can't button up the shirt. So activities throughout the progression will need to be adjusted accordingly. At the early stage, there is mild impairment, and common symptoms are things like forgetfulness, communication difficulties, and changes in mood and behavior. During the middle stages, this is generally where we see a greater decline in the person's cognitive and functional abilities. So memory and other cognitive abilities will continue to deteriorate, and they may require assistance with daily tasks like shopping or housekeeping, getting dressed or bathing. And then in the late stages, the person eventually becomes unable to communicate verbally or to look after themselves. And this is generally where care is required 24 hours a day. So this is where someone would consider moving into long-term care because their needs are difficult to meet at home. And when the person nears death, comfort measures become more of a focus on all the dimensions. So making sure that they're physically comfortable, they're emotionally comfortable, and that their spiritual needs are being met. So it's also important to remember that dementia is not a normal part of aging. And while most of us will notice some changes as we age, the more serious concerns related to dementia do not happen to everyone, and they cannot be explained by normal aging. So for example, it is a normal part of aging to forget details of a conversation that happened a year or 2 ago. But when we start forgetting things or events that happened recently, like a day or 2 ago, maybe even a week ago, this can be cause for concern. Or if details are forgotten more frequently as well, not just the length of time. You may also forget where you put your keys, and that's a normal part of aging. But with dementia, you would forget what your keys are for. So it's not being able to identify those objects anymore. With normal aging, you may forget an acquaintance's name, but with advanced dementia, you may forget people who are close to you. And with normal aging, you may be worried about your memory because you're noticing the changes, but a more serious concern is when your relatives or people that are close to you start noticing those changes in your memory. So how do we support the person living with dementia? It may be your spouse, a parent, a family member, a friend, or a neighbor. But regardless of who it is, we want to remember that they are still people too. There is still a person behind everything that's going on. And that's why we say a person living with dementia, because the disease or the diagnosis doesn't define them. They are still a person, and that should really be our focus. We want to remember to be patient. It's not their fault. They're not trying to push our buttons or trying to ask us the same question over and over to annoy us. It's not their fault. It's just their brain is changing, and they're not aware of these changes, and they can't help it. Sometimes it takes a person living with dementia longer to process, so we want to be sure to give them time to answer. If you have to repeat something or a question or a comment, we want to make sure that we say it the exact same way we said it the first time, because changing up the wording or rephrasing it can now cause their brain to have two messages to try and comprehend, and that can create some confusion and often frustration. We will also want to avoid saying, "Don't you remember? Don't you remember I saw you yesterday? Don't you remember I'm your daughter, Ashley?" And we also want to avoid correcting people if they've said the wrong thing. So we often say, we want to connect, not correct. So if they say, if an 89-year-old lady says they're waiting for their mother, we're not going to correct them and tell them that their mother's no longer here. We're going to connect with them. We can say, "So tell me about your mother. What's your favorite memory with your mother?" We never want to make them feel put down for what they're experiencing. And we also want to give the person living with dementia choice. So perhaps instead of saying, "What do you want to do?" where the options are endless and their brain would probably have a very difficult time figuring out how to articulate what it is they want to do, just the question is too wide open. We could give them options by saying, "Do you want to go for a walk or do you want to play a game?" So giving examples and choice as part of your questioning can really help the person living with dementia focus on what's being asked. So what's new at the Alzheimer's Society? These are just a few ways that we can help support you. So we have a tablet program. At the beginning of the pandemic, TELUS generously donated tablets for our clients to use. We also have our music and memory project, where we can upload an iPod with a person's favorite music for them to enjoy. And our gracious volunteers have also made these great activity muffs for people living with dementia who like to fidget. So they have buttons or different crocheted pieces on it that someone can just fidget or manipulate with their hands. We also have a pet adoption program with robotic animals, as well as recreation kits. So if you'd like more information on these, I'll put my contact information up at the end, and you can feel free to call or email me, and I can send you the forms or walk you through the process. So other ways that we can help, there's lots of ways that the Alzheimer's Society can help you, whether you're a care partner or a person living with dementia. We have great programs and services, one-to-one counseling, support groups, education like today's session. We have You First training for care partners, which is the same training that healthcare providers take as well. So it helps you to talk the same talk as healthcare providers, and it really looks at behavior changes and how we can support people that are experiencing those. We also offer a young onset adult day program. So that is for people who are diagnosed before the age of 65. We do have other recreation programs like Minds in Motion. Our services are also available in French. We do have respite services as well. So if you'd like to attend maybe a caregiver session and you need some respite for the person you're supporting, that is available as well. And we do have MINT memory clinics from Oshawa, Bowmanville, and Scarborough. And our annual walk is every May. And we're always welcome to new volunteers as well. So we are a not-for-profit organization. So all donations help us to continue to support our community. and any members that are in need. So if you're interested in donating, please feel free to visit our website for more information. And we are always looking for feedback and would love if you could just take a couple minutes today to complete this short survey about today's presentation. If you have a smartphone handy, you can just scan the QR code on your screen, or you can visit the website there. I'll just give it a second in case anyone needs to jot that down. And that is it for my presentation, but I'm happy to take any questions, and I really do appreciate you joining me today. I hope this was helpful, that you've learned some new information about dementia and some things to look for. If there's any questions, Julia, I am more than happy to answer those.
Great. Thank you so much, Ashley, for your presentation. I'm just going to stop the recording and then we're going to open it up for questions. We've received quite a